for inviting me as a special invitee in the webinar. Very, very important topic on respectful maternity care. So I warm welcome to each one of you, especially Dr. Lata and all the other organizers of the program. And the term, if we see, it's self-explanatory and it conveys its meaning that we need to deal with the women during her each phase of perinatal period with respect and each one of you will agree with me, and I think majority of the women are attending this webinar, that as such this is a second birth for a woman. So it's very, very important that whatever phases through which she is passing, we need to deal with her, we need to understand her emotions with a lot of respect, and we need to, and with lot of dignity. And we also know that a woman, she travels miles of 9 months journey of pregnancy and reach the hospital and awaits for the joy of motherhood. But we see that at many places she had to face disrespect. She has sometimes to undergo abuses from the other professionals during her delivery. And we see in India also some many such type of instances we have even witnessed. They exist even in the private hospital as well as in the public hospital. We also see many a times there are long queues of pregnant women. They are waiting for a health checkups outside the government facilities and being ordered to stand in line by the security staff wielding with sticks in their hands. So this harsh treatment which begins during her pregnancy, it sometimes continues during her labor room even. So these types of memories of disrespect during her birth, it lasts a lifetime. What she remembers each and everything, that this is how she was dealt with during all the phases of her perinatal period. So these types of memories, they instill a fear and lead to distrust in the healthcare systems. So one of the very beautiful approach which we have come out with is the respectful maternity care, which includes protection her from the verbal, from the physical abuse, from the disrespect and discrimination which she usually gets from various types of persons. So I think this is very, very important topic on which we are going to have a very eminent speaker from Delhi, Dr. Lata, and one more speaker. And they are going to share with us their own experiences and very hardcore, textual regarding this particular topic. So we are waiting, for this deliberation to happen, and over to the organizers, please. Thank you so much.
So much, ma'am, for your kind words and word of wisdom to encourage us to do all this kind of activity. And as you are our advisory board member also, you always advise us to do the excellence. So thank you so much, ma'am. And now I would like to introduce you with the moderator of today's seminar, that is Dr. Pragya Pathak, who is an associate professor at College of Nursing at AIIMS, New Delhi. So over to you, Dr. Pragya, for the next part of the session.
Thank you, Dr. Ujjwal. So, good afternoon, everyone. It's my privilege to invite the renowned speaker for today's session on the National Conclave on Respectful Maternity Care, Madam Dr. Lata Venkatesan. She is the principal. She needs no introduction. She is the principal College of Nursing, and then she is an excellent leader, and she is a renowned speaker and a dynamic leader. So she needs no introduction, and I'm extremely delighted that we have Madam with us for this today's session. So the session will be followed by the panel discussion, and in the panel discussion we have Dr. Ruby Bhatia with us. She is the professor and HOD from Mullana University. Mrs. Venkata Lakshmi is there from 9th PGIMER Chandigarh, and Mrs. Prasanna Jaili is there from assistant professor from AIIMS Rishikesh. So I welcome you, ma'am, and I invite Madam Dr. Lata Venkatesan for her session. Over to you, ma'am.
Thank you, Dr. Sukpal and Dr. Pragya, for that kind introduction. And I'm thankful to the organizers from IAB, am I pronouncing correctly? Integrated Association of Medical, Basic and Social Scientists. First time I'm hearing such a multidisciplinary association, and I'm extremely thankful to the organizers for inviting me to be involved in the activities organized by them. Even in the new national education policy, multidisciplinary approach to healthcare and multidisciplinary approach to education is being encouraged. I think in that regard, the association has already set the premises how important it is to have multidisciplinary approach in whatever activities we do in the field of healthcare and nursing care. And today I am asked to speak about respectful maternity care, especially how to tackle the disrespect and abuse which happens in facility-based childbirth. So I would like to start my presentation with a report which was published by White Ribbon Alliance of India. I don't know how many of you know about White Ribbon Alliance of India. It is for safe motherhood. And this WRA has published a very interesting report. You know, always any policy is framed or any protocol is being advised, it goes from top to bottom. But here they have used the bottom to top approach, because we need to understand what the stakeholders want, what the women want in case of the respectful maternity care. So this report was really interesting. They have spoken to the women across the states from many districts from different walks of life. And it is not hundreds or thousands of women they have interviewed. They have interviewed a huge number of women amounting to 3,35,000 in number. It's not an easy task and very interesting report. So I will recommend all of you to read this report from WRAI. In that report, of course, the women wanted so many things. They wanted good water, safe housing. But interestingly, if you look at the findings, 18% of them wanted equity, dignity, and respect. So more than the basic needs, women want them to be respected. So this report is a very significant one, and we can attach this to respectful maternity care as well, because every woman undergoes this phase of childbirthing cycle at some or other point of their lifetime. And also they said the demand for the availability of healthcare professionals. They demanded that the healthcare professionals must be available in the facilities. So it shows that they have experienced the health professionals are not available when they went for their care. 13% of them have experienced. 13% of 3,35,000 women is a significant number, and this report is really alarming. Only if the healthcare professionals are present adequately in number, then only we can talk about respectful maternity care. If the professionals are not available, then who is going to provide respectful maternity care? There will be only avoidance of care, first of all. So these are some of the reports which are awakening our thoughts related to the kind of experience the women undergo, especially during their childbirthing process. And the categories of disrespect and abuse, any women who is approaching for her reproductive health care may experience physical abuse, non-consented care, especially when labor progress is delayed or something unexpected changes happen. Usually the interventions are done without taking consent from them. Of course, for cesarean section they may be taking, but for the assisted vaginal birth or if blood transfusion is required during the surgery. So these are some of the areas where non-consented care can happen, and non-confidential care, non-dignified care, including verbal abuse, discrimination based on specific attributes, and abandonment or denial of care, and detention in facilities. These are all the major categories of disrespect and abuse identified during the childbirthing process of women. And if you look at the categories of disrespect and abuse, at the same time we also must have awareness about what are the corresponding rights of women, because when the rights of women are not respected, then it results in disrespect and abuse. So let us see that in detail. If you look at the universal rights of childbearing women, if they undergo physical abuse, we have to remember it is the right of the women to have freedom from harm and ill treatment. And when there is a non-consented care, we need to remember it is the corresponding right, that is right to information, informed consent and refusal, respect for choices and preferences, including companionship during maternity care. And they are also having the right for confidentiality and privacy, dignity and respect, for equality, freedom from discrimination, and have equitable care, right to timely health care, highest attainable level of health, liberty, autonomy, self-determination, freedom from coercion. So these are all the corresponding rights of women, and all nurses, all the healthcare workers must be educated about this rights of women and how we are bound to be respecting these rights. And if we are not respected, then the women can go for claiming that their rights were denied or rights were neglected. So let us look at these categories of disrespect and abuse. There are some testimonies from women how they have experienced. So let us see how it is actually happening in the healthcare settings. If you look at physical abuse, we have taken some verbatims. Of course, the verbatims are taken from some other country. I have not included from India, because if you listen from India, it might be taken personally by someone, or some people may attach it to their personal settings, or it may hurt us. Is this happening in our own areas? So the examples I have taken from elsewhere, but I am sure all of us will know the same thing might be happening in our settings also. So let us see how the physical abuse is being reported. When a woman goes into the second stage of delivery, you don't want her to close her legs, so you're beating her. This was reported in Kenya. This includes hitting, slapping, pushing, or even roughly touching a woman is also included as physical abuse. And all physical contact with our patients should be gentle, comforting, and reassuring as much as possible. Freedom from physical abuse is the right of each of our patients, which should be kept in our mind. And if you see the second category of abuse, that is non-consented care. Again, if you look at a report from South Africa, it says providing explanations to less educated women is not a good use of time, as they cannot understand. So we also think that, okay, the women may not understand the medical interventions. So we don't give the choice of choosing a kind of treatment which they have to undergo. So language use and level, educational attainment and cultural background may vary among our patients. All need careful explanation of proposed procedures in a language and at a level they can understand, so that they can knowingly consent or refuse a procedure. So the freedom to consent or refuse care is the right of each of our patients. The third disrespect category is non-confidential care. I was assisted by one of the patients who was waiting to give birth. The nurse later came and took the baby, then told me to get up and wipe the bed. See, the woman was asked to clean the bed where she delivered, because the next patient has to come. The patients have the right to privacy and confidentiality during the delivery of services. This includes privacy and confidentiality during counseling, physical examinations, and clinical procedures, as well as in the staff's handling of patients, medical records, and their personal information. We must do whatever is possible to protect the privacy and confidentiality of our patients and to keep the mother and baby together at all times. Confidential care is the right of each of our patients. So here also we will see in many settings, the women will be breastfeeding, privacy will not be there. And in labor room, where a number of deliveries are happening, the curtains between the labor cots will not be available. So a woman will be witnessing the delivery of the other one. So like that, each one of us, if we talk, maybe all these will come out during the panel discussion. We will have number of observations where the confidentiality of the patients has been compromised. And non-dignified care. One nurse told me, "Lady, can't you see that you are in the way? Go over there. You aren't anything but an animal, and talking to you is just like talking to an animal." So can you imagine? It is so disheartening even to read these kind of statements. But such things are happening. Maybe we may not call them as animal, but we may use very harsh language or some other words we might use which will hurt the women. So every woman we care for is a person of value and is worthy of our respect. We must honor the dignity of each woman in our words, our actions, and in all of our non-verbal communications also. The fifth disrespect is everything that came out of her discrimination. Here is the verbatim. Everything that came out of her mouth was the color of my skin. She goes, "You're the first dark person I have ever heard." I sat there and had to deal with that. After that, I left and never went back. This was the verbatim of a person in USA where discrimination among black and white is very much prevailing. All women are equally worthy of our respectful care, regardless of their ethnic background, culture, social standing, educational level, or economic status. So discrimination is never accepted, and non-discrimination is the right of each of our patients. And the sixth one is abandonment of care. You just call until you get tired, and then you finally deliver by yourself and die. I have even witnessed it myself. This is another verbatim from a skilled care person. A woman in labor or immediately after birth should never be left alone. Usually during first stage of labor, they will be ambulated and they require a lot of support. They require fluids to drink. They require encouragement. They require guidance to relax in between the contractions. But usually they are left alone. But at least in labor, some amount of attention will be paid. But postnatally, once a mother delivers, they are completely neglected in many settings. In my own experience, I had one of our colleagues delivered the second baby. It was a normal vaginal delivery. The first one also was normal vaginal delivery. And it was a very busy setting where minimum of 40 deliveries, 40 normal deliveries happen every day. So she was in the observation room during her fourth stage of labor, and much attention was not paid, and she has not passed urine within 1 hour of childbirth. And finally, after a few hours when she was attended, she has already entered into HELP syndrome and was profusely bleeding. Around 70 to 80 pints of blood was given, but she was also taken to the theatre, but we could not save the life. Our own colleague who was working in the same labor room when she delivered, we lost her. I do not want to mention the name of the hospital or when did it happen, but it is the real story. So observation even after birth, during the fourth stage of labor and during the postnatal period is also highly important, not to lose them due to the complications. So these are some of the examples we can share. So we must understand, if you are leaving your patient, tell her when to expect, when you will be returning, and how to get the help if needed. Attentive care is the right of each of our patients. Women should be able to have a companion of their choice, such as a family member or a community doula with them throughout labor and birth at the health facility to provide continuous support. And the seventh one is detention in facilities. When I got the bill, the doctor said to me, since you have not paid, we'll keep you here. This happens in many private hospitals where the woman cannot afford to pay for the care what they have received. So they are being detained unnecessarily. Now that early discharge is being promoted, after normal delivery, within 24 hours they are being discharged, and after cesarean section, maximum they stay for 3 or 4 days. But if you keep them for more number of days unnecessarily where the medical care is not required or nursing care is not required, it is unethical. So a woman or her baby should never be forcibly kept in a facility. So freedom from detention is the right of each of our patient. And here also we can see the moment the discharge is been advised, how long it takes to actually discharge the patient and the patient leaves the hospital. This is one area we can study. What is the time taken for processing the discharge? And according to White Ribbon Alliance, they say, how can you use the Respectful Maternity Care Charter to address disrespect and abuse in your sector and setting? This is this you can share with them, because every month the WRA conducts a meeting in which the aspects of RMC are being discussed. And we hope you will be able to inspire to visit this website, White Ribbon Alliance, and share your observations or share your suggestions, opinions, and help them to take action. And if you see, equity, respect, and dignity is the right of the women we saw. So how to provide that? What are all the strategies recommended by WRA in relation to this kind of aspects of care? They say commit yourself to zero tolerance for disrespect and abuse during maternity care services, and adopt respectful and dignified care standards and corresponding monitoring. It is not only educating the nurses, educating the patients and family. We need to monitor actually how far we are implementing the RMC and report and have appropriate redressal mechanisms. Endorse and display the Respectful Maternity and Newborn Care Charter, that is the patient's rights and their eligibility for care in the local language in all the health facilities, and invest in respectful and dignified care training for health workers and rights education for communities. Ensure that all women are allowed a birth companion during labor and delivery. I think now this is widely happening, but the birth companion also need to be prepared. Otherwise, they will require more care than the woman who is in labor. So preparing the birth companion right from the antenatal period also has to be paid attention. Facility improvements. You have to ensure clean facilities. Usually labor rooms will be smelling, or it will have the unwanted items being stocked, and the cleanliness has been not up to the expectations. Functional toilets may not be available, hand washing facilities may not be available, potable drinking water may not be available, especially in antenatal OPD. How many OPDs we have seen where the potable drinking water is available, not only for antenatal women, for any type of patients. So these are some of the areas we have to pay attention. Invest in menstruation education, availability of free and affordable menstrual products, and menstrual waste management systems within schools and health facilities. Here I would like to share, in AIIMS College of Nursing, we started an initiative of sanitary pad bank. You know, during birthdays we cut cakes, we give food in orphanages, but usually this providing sanitary pads is also an act of charity. And we distributed this to the construction worker women. In AIIMS, part of master plan, lot of construction is going on. A huge number of people and families are staying within the campus, which has women in the reproductive age group. Many gives them food or clothes, but the sanitary napkin is very rarely thought of by anyone. And we also gave the sanitary pads to domestic workers. There is a forum, Domestic Workers Forum, which has 2,500 registered domestic workers in different age groups. So when we gave the sanitary pads, they were extremely thankful. Some have reached menopause, but they said it is helpful for my granddaughter, or it is helpful for a woman in the family. So this was the feedback they have given. So these are all supporting menstrual hygiene, some of the activities we can think of. And involve locally elected representatives to monitor and ensure clean and functional health facilities. We should invite leaders from Panchayat or from elsewhere to come and visit our facilities and give their opinion how we should further improve. And uh, from Swachh Bharat Abhiyan flying squads, we can invite them to conduct the surprise visits to check the cleanliness. So these are some of the suggestions which are given. So when a third party assesses, they will be more the observations which go missing in our eyes, because regularly we visit the department. Some of the aspects we may not have been sensitive to understand the needs of the women, which may be brought out by the outsiders when they come and visit our facility. And availability of health professionals, increase the budget for health, especially for human resources, and fill the vacant positions. Ensure that at least one general nurse midwife is present at all PHCs. Ensure 24/7 availability of skilled doctors and specialists, and invest in improving the working condition of the healthcare workers, and provide them leadership opportunities, appropriate salaries, housing, security, etc. And there are also some suggestions which are given. That is, how respectful was your maternity care experience? You can share your own personal story as a receiver or provider, and you can tell about the experiences. You can submit it to takeaction@whiteribbonalliance.org. And also, what does respectful maternity care look like? You can get the creatives and share your vision of our RMC in any of the medium, like painting or photography, video, poetry, collage, drawing, etc. You can again submit it to White Ribbon Alliance. And you can host a discussion with friends, colleagues, and community members about respectful maternity care. So these are all some of the suggestions from WRA. The other day, part of the World Breastfeeding Week, we invited women who delivered to speak about their breastfeeding experiences. We invited primary, multi, working mother, non-working mother, mother of a twin, mother of a preterm baby, and those who delivered normally and vaginally. Each one had different kind of experience. And one mother was telling she had breast engorgement, which was very painful, and nobody has attended to her breast engorgement. So please do not think respectful maternity care means it is only how we are handling the mother during the first, second stage of and third stage of labor. No, how we are treating them the moment they conceive and come for confirmation of pregnancy, to that of they leave the hospital and when they come back for follow-up checkup postnatally, the span of respectful maternity care has to be ensured. So even attending the breastfeeding, not allowing the mother to have breast engorgement should be one of the quality indicator that how we are caring for them. So these are some of this one. You also have to monitor. It is not learning about respectful maternity care, sharing our concerns, having observations. We need to have structured monitoring of the interventions, whether it is happening adequately or not. So this is some of a kind of a checklist which is available from the net only. I have taken. You can have this checklist and make sure you review the level of RMC provided in your own institutions. So let this session be an eye-opening session for you to go and review the level of RMC which is provided in your institution and have some targets or quality improvements. How are you going to reach 100% RMC in your own settings? So you have to have the policy and guidelines on RMC. You have to have training and quality improvement. Due to time constraint, I am not reading this in detail. And you also have to assess your infrastructure, materials, supplies. Is it sufficient to provide RMC? Community involvement, how far you are involving the women and their family members in ensuring RMC. And also you have to see how it is being promoted. How it is being promoted, RMC aspect, respect for their beliefs, traditions, protecting their dignity, right to information, ensuring informed consent is taken, freedom of movement during labor, that is walking around, providing continuous support, choice of position during the birth, keeping the newborn with the mother immediately after the birth, keeping the mother and baby together 24 hours a day, avoid detaining the women unnecessarily, prevention of institutional violence, etc. Can I ask the participants to mute? And you also have to see, has your program or institution been monitoring RMC indicators? You need to have indicators. Quality performance indicators have to be there. This should be related to the policy, readiness to provide the service and actual practice. So you have to have the RMC indicators and please monitor how it is being done. You have to see how much time the baby and mother are together. Or do you have adequate resources? And how percentage of births with the companion, percentage of births in alternative positions. So like this, you can increase even the number of mother who have not developed breast engorgement percentage. You can have the um, uh, indicators based on your institutional services. And you also have to see that they are not abandoned. How is the cleanliness, confidentiality, all the aspects, food and drink which is being provided, discriminating between HIV women and non-HIV women, pain relief during labor, all these can be monitored. So whether the payment is affordable, staffing is adequate, physical abuse did it happen, privacy, any sexual harassment, assault and rape. I remember when I was a student, it was in one of the corporation maternity centers, a mother was lying down after 4th stage of labor in the labor room and somebody jumped and came inside the labor room, tried to rape a woman. You know, this was so many years before, 25, 30 years before. So these kind of things also happen, and scolding, shouting, insulting them. And as Dr. Supal was telling, that the security with the lathi in their hand, controlling the crowd, all these things have to be monitored, how the respectful monitoring maternity care is provided. So you also have to see from what data sources you are collecting data on RMC. That is, are you having the self-assessment, and where are you reporting, and how are you improving yourself, and how you are having the statistics of the care which is being provided, and to whom are you reporting. This also have to be thought of, because if you are reporting to National Family Health Survey or to NHM or accredited hospitals to NABH in the form of quality indicators, all those also will be a motivating factor to improve the services in RMC. So finally, this is the question to all of us. Who is responsible for RMC? It is me, it is you, or we. Who is responsible? I think it is the responsibility of each and every one of us to provide the RMC. So please do not think that RMC is the responsibility of the nurses who are working in labor room. Please do not think like that. RMC is the responsibility of all of us. So let us commit ourselves to work together and promote RMC. So thank you very much for the opportunity.
Thank you.
Thank you,
Thank you, Dr. Pragya, for successfully conducting this conclave and the panel discussion. And now I would like to take this opportunity to request Professor Anil Kumar Sharma, who is the HOD at Department of Biotechnology at Maharishi Markandeeshwar University, to say a few words at a concluding remarks. Over to you, sir.
Thank you, Dr. Ujjwal. A very good afternoon to everyone. First and foremost, I am extremely thankful to Dr. Latha Venkateshan for being very kindly agreed to this national conclave, a very important topic on a theme which is respectful maternal care. So I am extremely thankful and I profoundly thankful to Dr. Latha, who is the principal as well as professor, College of Nursing at AIIMS Delhi. And I'm also extremely thankful to the esteemed moderators, Dr. Pragya Pathak, then Dr. Professor Ruby Bhatia, who is the professor and head of Department of Obstetrics and Gynaecology at our campus itself. Then Mrs. V. Venkatesha, Venkata Lakshmi, who is the Associate Professor at National Institute of nursing education at PGI Chandigarh. So I'm really, really thankful for conducting this particular conclave very successfully, and uh, extremely thankful to Dr. Latha Venkatesan, who very elegantly elucidated about various know-hows, how to take care of this respectful maternal care. And to add on to that, I always feel in our scenario, in our society, there is always a lack of maternal health care also, because women are respected for their health only during that period when they conceive, and during the time of pregnancy and post-pregnancy. But in my opinion, I think our society should be trained in such a way that they they take care of the women's health throughout their lives, because women, mother, especially the mother, is the heartbeat of the house. And without her, I think there is no heart throb at all. So I think respectful maternal health throughout life, along with the respectful maternal care when she get into this labor and pregnancy, those things should be taken care of. And I think I truly anticipate that all the audiences and our faculty members, participants, they have been extremely benefited and rich from the knowledge shared by Professor Latha. And once again, from the core of my heart, please accept our thanks and appreciation for such a wonderful lecture. Thank you so much, and over to Dr. Ujjwal. Yeah, thank you.
Thank you so much for your this encouraging words. And now, as this is the tradition and custom also that we should thank all our participants and workers. For this, I take this opportunity to invite Mr. Rajiv Kumar, who is a founding member of IAMBSS. So, Mr. Rajiv, are you there?
Yes, Dr. Ujjwal. I'm audible?
Yes, over to you.
Yeah, thank you, Dr. Ujjwal, for this opportunity to propose vote of thanks. I, Rajiv Chaudhary, on behalf of IAMBSS, extend my heartiest vote of thanks to one and all present here in this National Conclave on Respectful Maternal Care, jointly organized by Integrated Association of Medical, Basic and Social Scientists, IAMBSS, Department of Biotechnology, Mullana, MMU Mullana Ambala, College of Nursing, AIIMS, New Delhi, and Department of Obstetrics and Gynaecology, MMU Mullana, and National Institute of Nursing Education, PGI Chandigarh. So we express our heartiest gratitude to Dr. Latha Venkatesan for accepting our request to be a keynote speaker for this important conclave. And thank you. And I extend my special thanks to our panelists, starting from Dr. Ruby Bhatia ma'am, Professor and Head of Department of Obstetrics and Gynaecology, MMU Mullana, Mrs. V. Venkata Lakshmi, Associate Professor 9, PGI Chandigarh, Mrs. Prasanna Jelly, Assistant Professor, College of Nursing, AIIMS Rishikesh, who agreed to be a part of this important discussion on very short notice, and your deemed presence has facilitated the discussion to achieve its desired goal and objective and outcome to share the knowledge with the audience. And also thanks our host, Dr. Pragya Pathak, Associate Professor, College of Nursing, AIIMS, New Delhi, for moderating the session very effectively. And special thanks to our participants, all participants, for showing your keen interest in this particular event, without which none of us would have come for this far. And lastly, but not the least, I want to thanks and congratulate the organizing team who do not leave any stone untouched for success of this particular national conclave. So feel free to reach us through our social media for future events. Thank you everyone for joining us today. And please ensure to fill the feedback form, and the link of feedback form is already shared in the chat section. Thank you all.
Thank you all
Rajiv.
very much.
Thank you, Rajiv.
Though it was a
Thank
short
you all.
notice, the invitation was shared only yesterday, and today we had full complement of participants attending the session. So
Yes.
congratulations, IABMSS. Thank
Yeah,
you.
and
Thank you, ma'am.
one of our esteemed speaker in the last seminar has very effectively and beautifully announced this IAMBSS. He said that say I am boss and just remove O from this, then it becomes IAMBSS. So
Oh,
you can say I am
Yeah.
boss and remove O from this, so it becomes IAMBSS. And thank
yes.
you so much. And thanks you much, Dr. Lata, that you accept our invitation in a very short notice. And thank you, Professor Anil Kumar Sharma, who is a very energetic force behind all our activity at MMU. Thank you so much. And I also thank Dr. Supal Kaur also. He is
Thank
our
you.
advisory board member. Thank you so much, ma'am, for
Thank
being
you.
here today. Thank you all, one and all. Thank you, sir. So have a nice day. Have a nice day to all of you.
Thank you.
Thank you. Thank you so much.
Thank you.
Thanks a lot. Thank you.